Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Winning.
And I'm Dr. Paul Zalzal.
And I'm Dr. Anita Grewal.
Dr. Grewal is a family doctor who has kindly graced us with her presence to talk about some myths about diabetes. The top 7 myths that people think are true about diabetes.
Now, before we start, we have to say how hard it is to get a family doctor, especially in these parts. So we really appreciate your time. And we had to trap a family doctor. We put out some donuts and coffee. We put out a bottle of red wine. We put out some vouchers for childcare, and lo and behold,
you got one.
Yeah.
Get one to come in and talk to us. So thank you.
And in 3 dimensions, not on the phone, because the pandemic has been really tricky on lots of levels. So yes, thanks for joining us.
We
You're
really,
welcome.
really sincerely appreciate it. Thank you.
Okay.
I'll give you my invoice later.
Right.
Yeah.
Deal.
So number 1, what is the number 1 myth that people think is true about diabetes?
That they ate a sugary diet and that caused their diabetes.
Okay, so not true. You didn't eat too many sweets. That's not why you have diabetes. So
I've been avoiding sweets for a long time just because of that myth.
Well, I mean, it's not a good idea for you to eat sweets when you have diabetes. It sort of puts an extra load on your system, but it is not a causative factor. So diabetes type 2 is caused by the relationship with insulin and your pancreas.
Hello, Twix bar for breakfast.
And just for our viewers, so really what diabetes is a complicated way of our body handling a sugar load, essentially. We are not able to manage that properly.
Yeah.
And there are different types. So in a short way, what is the main difference between type 1 and type 2, just for people to know?
So type 1 deals with insulin not being produced by your pancreas, okay? To really simplify it, type 2 is insulin not being sort of recognized or received by the receptors on the cells that it needs to target. And over time, it's also a decrease in the insulin production. So there's 2 factors.
Okay.
But type 2 in North America, so in the US and Canada and Europe, is actually 90% of the load of diabetes care.
Okay.
So
we'll do a video. We're going to do a whole video on diabetes.
Yes. Just so
great.
that people know.
Yeah.
Okay, so number 1, sugary diet does not cause your diabetes. Okay, number 2.
Number 2 is I'm overweight and I'm going to get diabetes.
Okay.
So weight is a risk factor for diabetes, but not necessarily the case that you're going to have diabetes because you're overweight.
But if you have someone who has diabetes and they are overweight, is the first thing you do encourage them to lose weight?
Absolutely.
Okay.
So one of the first things that we suggest is lifestyle modifications, and weight loss is one of them.
Okay.
So you can be overweight and not have diabetes, but if you are overweight, it may be contributing to your diabetes.
Yes.
Okay.
Okay.
That's number 2. Number 3.
Number 3 is the flip of this. I'm skinny, I won't get diabetes.
Right.
So that's not also the case. Remember what we said, it's about your insulin, and so that does not necessarily have to do with your weight size, right? So it's a function of how much insulin you have working and that's being sort of received and recognized, and production.
So your pancreas and your receptors don't necessarily know your weight.
Yes.
It's a secret.
All right. So you're thin, you can still get diabetes?
Yes.
Correct.
I think that's a common one. People really believe that. Okay, number 4.
I don't have any family history. How can I have diabetes? So you often have that come into the office and they're shocked.
They can still get diabetes even though no one in their family has diabetes?
Correct. So
Okay.
the reverse way to think, it does increase your risk. So there's risk factors for developing diabetes. Family history is one of them. Having a primary family member will increase your risk. However, there's plenty of people that will get diabetes that have no family members that have diabetes.
Okay, one of the things your parents not necessarily passing on to you that you can still
Not necessarily.
So you're not off the hook.
No.
If you have a family full of non-diabetics.
No, you're not off the hook, but if you have diabetics, you're
Might be on the hook. You're on the hook. Okay.
You may have issues with your parents, but if you have diabetes and they didn't, that's not one of the things they gave you.
Okay. Number 5, I think, is a really, really important one. So let's talk about it.
Number 5 is diabetics need a special diet. They will never be able to have carbs. They'll never be able to have sweets. I think it might actually delay a lot of people from wanting to recognize their diabetes because they're afraid they're going to be committed to a lifestyle and a label that they don't want. And that's not true. So you can have sweets, you can have carbs. I think way back even before we trained, there was the idea of counting your carbs. A lot of people grew up with that notion. You don't look at it that way. I think diabetics, just like everybody else, needs to eat a healthy diet. And you take into account your diet and then you adjust your insulin or your medications.
And when you say a healthy diet, you mean more fruits and vegetables, more whole foods, less processed foods, less high fat.
Exactly, and I would even go as far as saying a plant-heavy diet. And so, and minimize your sweets. But if it's a birthday or it's Christmas, you're gonna have some sweets. The idea is to think about having some indulgence in moderation and accounting for that with your medications, but not also feeling deprived or living in that kind of life where you're never gonna have a sweet.
Okay, yeah, so this is an important one, like, if I can read between the lines, because that myth, if people really believe that myth that they can't eat sweets and carbs anymore, that's gonna stop them from going to get their sugars checked, that's gonna delay the diagnosis and end up doing harm. So if you believe this myth, it will do harm because you're not gonna go get it checked out. But if you understand that once you're diagnosed, you can still eat carbs and occasional sweets and occasional indulgences.
Exactly.
Don't worry about it. Go get it checked out.
Yeah.
Because you can still live a fairly normal life.
Exactly. And it's also factoring in on the later stages where they come back to me for follow-up and they've got a bad sugar on their results and they feel guilt.
Okay.
And so it's not a good way to live. You don't want to live feeling guilty. We look at that and say, well, what's the reason? Was it because of the activity? Was it because of your diet? Do we need to adjust the medication? You have to remember what I said earlier about the insulin production drops as you go along in your diabetes. So maybe it's a signal that we have to adjust medication. So it's not just, you ate too many sugars this month.
Right, so it's not your fault necessarily.
No.
So I think that, people feel a lot of, like you said, guilt and blame and whatnot. So, hey, if you have the diagnosis, we're just gonna try to figure out a way to get you diagnosed and then get you proper treatment so that you can live a happy, healthy life.
Yeah, and then it promotes that sort of dialogue, right? So you have a partnership with your physician and you're hopefully can sort of talk about it more openly about what you're doing.
Okay, so that was number 5 of 7. We've got 2 left. So number 6, I think this is also an important one.
It is, so borderline. So
Borderline personality?
Yeah, you'd be good at diagnosing that.
That's another topic. Borderline sugar or borderline results. Here, I'll reference my practice, which is I'll test early. So I'm screening people when they're in their 40s for their cholesterol, for their sugar. So I often pick up borderline sugars. For some patients, that's like, okay, well, that's nothing. I don't have to worry about that, but it's often an early signal. So your pre-diabetic label comes in when some of those measures on blood work put you in that reference range. And there's a good chance that you're going to proceed in the next 5 to 10 years diabetes. So you do have to pay attention.
Okay, so if you are diagnosed with a borderline sugar level, don't put that away. Keep that in mind and have that checked again in a year or 2. Or
I usually check yearly if they're really worried or they want to be a go-getter or they want to start making changes with their diet or their lifestyle, then we'll check it early. It's a good opportunity for people to start making those changes around weight, getting healthy, getting into exercise.
Excellent. Yeah, gives you the heads up on something that may be down the road, but something that you can actually avoid.
Yeah.
Okay.
For sure.
And last, but certainly not least, I'm cured of my diabetes. I've got my sugars under control.
Yeah.
I don't need my medication anymore.
So I think this is actually a myth that goes across a lot of treatments that we do. Patients start to feel better, whether it's their depression or their diabetes or their cholesterol.
Yeah.
We get them to target, which is fantastic, and then they think they're done.
Yep.
And they want to come off, or they don't even tell you when they come off their medications. So, unfortunately, you do need to stay on these medications. Can you have it reduced? Sure. And if you do something significant like lose 100 pounds, we're going to probably have to adjust your medications to sort of bring it down. But you do need them when you're a diabetic.
So 100%. So could there ever be a scenario where, say, a type 2 diabetic that was adult onset, lost 100 pounds, could get their sugar so under control and their receptors so amazing that their sugars would be normal on a healthy diet and exercise? Is that a possibility?
I've had that happen.
Just uncommon.
Yeah, uncommon. I've had that happen, but it's sort of a younger person. It's sort of 40s to 50, where they've developed diabetes early. They're not living a good lifestyle. They manage to get all of that in check, and so we take them right off their meds. We don't have a clear, like the Canadian guidelines don't label that scenario sort of, are you still a diabetic? Are you not a diabetic? I tend to tell people that you're in remission.
You're like a recovering diabetic. You're a recovering diabetic.
So we kind of watch that person still the same way, I screen them the same way,
right. And
now they're using their lifestyle measures as their treatment as opposed to just their medications or the combo of both.
This is a tricky one because we've seen in a lot of our comments that there's some distrust with big pharma and medication. So, and some of it, is justified because a lot of the big studies are funded by the big companies that have an interest in the outcome of the study. So if, a pill for every ill sort of thing. So that's why this myth, I think, is important. If you do get diagnosed with diabetes and you're on medications and your sugars come down, you're well controlled, you still need those medications. But I can appreciate that a lot of viewers right now are like, well, wait a minute, I don't trust the big pharma companies that are marketing these pills and these medications. So we hear you, recognize it and appreciate it, but our recommendation is that you should stay on that medication if it is controlling your sugar. It's not like you're cured from it, it's sort of the medication is helping you maintain that sugar level back down.
Right, and if you're like in remission, you just keep an eye on it and you're using that diet as that strategy. And when you need to, or if it progresses later down that you need to get back on it, then you get back on it. And we titrate up as we need to.
And I think the important thing to recognize, we're going to talk about this in a follow-up video, is that the reason for dealing with diabetes is really the long-term issues. It's not like in the moment when you have a sugar that's elevated that you necessarily feel badly. Yeah. It's just the consequences of having a persistently elevated sugar that leads to multiple other problems that we'll talk about.
Exactly. I think the overall view of this should be in these myths in treating diabetes is that you have a high sugar, and that sugar molecule traveling around your blood cells in your bloodstream is causing damage. And your goal here is to not have that happen. You don't want a high sugar traveling around your bloodstream, going around, hitting those arteries that are key to all the rest of the organs. So whether it's your diet, whether you got, lost that weight or managed your other risk factors or use medications, the goal is not all those labels, not all those details, get your sugar down.
Sugar, not so sweet after all.
Not so sweet. That is a great summary, Dr. Grewal, of the top 7 myths about diabetes. If you guys like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
Thanks so much for joining us.
You're welcome.
Did you enjoy it? Will you come back again? You were awesome.
Yeah, I'll try.
Thank you so much.
We'll see you next time.
Bye.